What is health-based dentistry? What does it really entail? So many people ask me these questions. What are you doing differently? And it's funny because at the beginning of really my transition to health-based dentistry, people would come and say things like, I don't really notice a lot different here. What are you doing that's different? And so we started being really conscious about that, about telling you why we're doing what we're doing and showing you why that impacts your health in a good way. So let me give you the top 10 things that we do differently. And I think it's really going to help you understand what it is that we do and why we do it. The first one is we really focus on remineralizing. We say and believe that you can heal cavities. And this is a big thing that's definitely not embraced fully in dentistry in general. There are fluoride alternatives today called hydroxyapatite. And what hydroxyapatite is simply the mineral that your teeth are made of. So when you're starting to get a cavity, what's happening is minerals are being pulled from the tooth and leaving holes. Bacteria crawl into those holes, they excrete more acid, which creates more mineral problems and the bigger hole, and now you have a cavity. So we believe that if the cavity is still in the outside mineral layer of the tooth, that you can heal that cavity with hydroxyapatite. So remineralizing options is 100% a part of health-based dentistry. Hydroxyapatite is the key. Ozone therapy. Ozone is pretty incredible. It is a much more powerful disinfectant than chlorine or any of these other disinfectants that are commonly used. And the cool thing about ozone is it's simply oxygen. Ozone is three molecules of oxygen hooked together, leaving one molecule unstable. It doesn't like being with two. It wants to be with its own pair. And so it goes to find something to bind to. And what does it grab onto? Bugs of all sorts and shapes and sizes, bacteria, virus, fungus, parasites. It kills them all. Not only that, but it's anti-inflammatory, it's antioxidant. It actually helps with pain relief. It stimulates healing in cells. So many different things. Ozone absolutely is a necessity in health-based dentistry. Another one is oral probiotics. So we really understand the importance of the bacteria that live in the mouth. They are a part of keeping you healthy and keeping your mouth healthy. So you don't want to kill them all with using like a high alcohol content mouthwash, like Listerine. You don't want to do that because you're going to kill off all the bacteria, including the ones that are defending you. So we want to the good bugs and kill the bad bugs. So it's going to equalize that balance in the mouth. Myofunctional therapy. What does that mean? Myofunctional therapy is all about the muscles here in the face, in the tongue, in the lips, in the back of the throat, and really understanding how should they function. And you might think that, well, don't we all just do that okay? You'd be surprised. There's a lot of growth and development issues that happen, even things like tongue ties and lip ties that lead to your muscles not actually working the way they should. So what does this lead to? This leads to breathing issues. This leads to swallowing problems. This leads to crowded teeth or crooked teeth, to tongues coming forward and leaving an open space here between the teeth when you bite. It leads to kids not growing correctly and having ADHD symptoms and sleeping problems, all kinds of things. So we address all of that and teach you what to do. Non-invasive diagnostics. What does this look like? So we do things like we have a laser that we use to detect cavities. So much more accurate than just the pokey thing. The pokey thing is the way that most dentists diagnose cavities. Well, on the chewing surface of the tooth, we actually use a laser to diagnose that. It's fabulous. The other thing we use is an electric pulp tester. So instead of putting a cold thing on your tooth and having you jump out of the chair, we can actually diagnose exactly, is that tooth still alive, with just a little vibration in the tooth. So a lot of these non-invasive diagnostic techniques are more accurate, but also more comfortable for you. Another thing is abrasion. So people ask all the time, are sealants great? Do you recommend sealants? The key is the tooth clean before we seal it? And the way we ensure that is using abrasion. It's a fine mist of particles that actually get in and kind of sandblast the teeth really clean. We use that before placing any restoration. So crown, filling, onlay, sealant, we want to make sure the tooth is perfectly clean before we actually put that new thing on. Dietary recommendations. This is a big one that really differentiates us. We talk all the time about how does your diet influence your tooth health? Because I'm a believer, you never have to have a cavity. You never have to have one, ever. Well, how do you do it? Not just by brushing and flossing. Of course, that's important, but it's also about what you're eating, when you're eating it, and is your body assimilating or absorbing it properly? We talk a lot about that. Oil pulling. This is kind of an interesting one that you can do at home. Oil pulling goes along with that probiotic concept. Can you really balance the bugs in your mouth? This is an old Ayurvedic technique from India where they use oil to balance the bugs in the mouth. Check it out. I recommend doing it about every 3 days. Oil pulling, you swish with a tablespoon of coconut oil is my preference for about a minute, or excuse me, 10 minutes, not just a minute, for 10 minutes. Spit it out into a Kleenex, and oftentimes that really helps with gums and the way that the gum bugs are working. Digital imaging. So a huge thing in our practice. You pretty much can't come into our practice without getting a cone beam CT scan. Why? Because we see so much, and we simply cannot treat you appropriately or like you deserve without being able to see what's going on. So we use very low dose, everything digital, but it's important. We have to have that diagnostic tool. That's cone beam CT scan. And the last one is sleep options. So everything here influences your sleep because it's all muscle related. And if the muscles and the structures don't allow for enough air to get by, you can't breathe properly. It's not just about putting this mask on your face and shoving out oxygen down your tube or bringing your bottom jaw forward and holding it in a very unnatural position. Those are actually not things that we offer as sleep options. We instead want to actually change your mouth. We want to fix the functional and structural issues that are leading to the sleeping problems. And we can do this in kiddos and adults both. So that's the top 10 of things that we do here differently. That's what you need to be looking for. And those are the things that really influence your health over the long run. I'm so glad you're interested in it. Help us spread the word, start asking for this, and more dentists will start providing it.